Hey, good morning and welcome to Your Personal Health. I'm Jeff Harrison. I'm your host, and I have two experts back in the green room. They're in the green room. They're just putting a little powder on their nose, maybe a little lipstick on. Check for Dr. Michael on his eyebrow shadows. He just looks great today. Remember, last week was his birthday. We wanted to celebrate that. We'll ask him about how that went. And today we're, on their other show, COVID-19 update. I don't know if it's still COVID-19, but it's still the COVID update. There were a lot of good information on there. The numbers are going down, but we want to stay respectful and keep the efforts in place about wearing our mask, and washing our hands and just being mindful when we're out there. We're starting to really see those numbers drop. We're still not out of the zone yet. You just need to go back over and check that out. But today we want to talk about something that, unfortunately, it is a growing. The numbers are growing. They have been for a while, and they're tied to a lot of things. I'm not going to get into that because I'm not a doctor. I don't even play one on television. But we're going to get the experts in. So let's bring in Dr. Burris and Dr. Kim. Good morning, you guys. How you doing?
Hi, doing good.
Good morning.
Hey, as we go through life every day, we talk about stress and the fact that the show is called Your Personal Health. That's what drives the message on this. And one of the things that we talk about is how do we live life in an optimal state versus we're always fixing, almost like as we get older, I hate to say this because I'm starting to, as we look at the gray on my face, we're starting to be like an older car where it takes a little bit more upkeep to keep it running. And maybe we take a little more gas because we don't have the same energy we had before. But really, I want to talk about something today that seems to be very prevalent. It seems to rank really high, and that's high blood pressure. First of all, let's talk about what is high blood pressure, and then we'll dive into some of the known causes, and are there any cures, or is it something we maintain? What would you recommend? So let's start out with that, and let's start out with, hey, what is high blood pressure?
Well, Dr. Burris has been so generous. Allow me to tell a quick little story that happened to me the other day. So, and I promise it has to do with a little bit of high blood pressure. No, it does. Our daughter's playing golf, and she asked me to go get her water bottle from where she was. And if you've ever been at the Marriott out here, you know that the practice range is quite a distance away from the parking lot. And so I had to walk the distance. Well, I had a bottle of carbonated water because I was going to drink that because I was going to follow her. And it was about 110 degrees that whole day. But so I didn't remember it was in my little backpack. So I walked to the car and walked back. I was so thirsty, I opened the water up and it exploded everywhere. And so it got all over me, it got all over everything. I'm like, oh, I didn't even remember that was there. And so that's kind of like high blood pressure. It's kind of a silent thing. When you have high blood pressure, you don't know that the pressure in your body, which is a closed system like that bottle, and there are things that will make the pressure in your body go up, just like there were things that made this thing go up. If it sat there, it wouldn't, but I was jiggling it around, it went up. So that's kind of basically what high blood pressure is. I don't know if you want to.
Yeah, high blood pressure is a really interesting thing because as far as I can tell in medicine, it's probably the most applicable issue that we had to learn physics for, because it's all about flow dynamics. It's about pressure in a closed tube system. And so there are two different problems when the pressure in that system gets high. One is if it gets high enough, it can do what your drink did, which is blow up and like cause pipe failure, basically burst the pipe and bleed somewhere. And if that happens in the brain, it can cause a stroke. Or if it happens in a big artery, like in the aorta, it's called a ruptured aneurysm that can cause death. So those are like really scary things that can happen with high pressure in the system. But most people with high blood pressure don't end up with that as a problem. Really, what they have is a lower level of high blood pressure that over time damages their pipes, basically. And one of the things that, when you're just talking to people, you can often be surprised at how many older people have high blood pressure, even if they live a very healthy lifestyle and are very physically active, eat well. And the reason for that is that part of high blood pressure is the blood vessel walls being less stretchy as we get older, because the collagen in those blood vessels is going down. And so instead of having a nice stretchy blood vessel, you get one that only stretches a little bit. And so the pressure in that tube, when you got the blood pumping through, is higher than if it stretched out nice and big. And so that's one reason that people tend to get diagnosed with high blood pressure as they get older. It's partly genetic, partly age-related change, and partly lifestyle. So some of those things we can change and some we can't. And so we'll kind of get into that. What do you consider dangerous, scary high blood pressure? One that you like, this is an emergency, you're in danger of having a heart attack or a stroke right now, this is really scary, you need to go to the ER or the doctor immediately. How high do people have to worry about?
I think it depends. I don't know if there's an actual number. I guess it really depends on who you are. But if I didn't know someone, if I had to venture a guess, for me personally, if someone was above 160 over 100, I would be very worried, and I probably would say you need to see someone, whether it's in the ER, your doctor, urgent care. I think to me that's getting to a high number. I know there it says 180 over 110, but there's the 160 over 100. That to me, I'm starting to get worried.
Yeah, for me, I'm more the 180 over 110, unless somebody has symptoms. So if you have symptoms from high blood pressure, which could be like chest pain or a bad headache, even if your number's lower, I'd want to address that immediately. So chest pain, shortness of breath, bad headache with your pressure being up are emergency warning signs. So now let's talk about these numbers. You can put that chart back up a little bit if you don't mind. Oh, can we restore this flexibility? No, not yet.
Right, we don't have the technology to do that.
Yeah, there are many people who advocate supplements, who say they'll improve collagen or whatever. We have not yet seen that type of approach perform at a level that we can confidently say, yes, this can reverse that age-related stiffness. So although there's a lot of interest in it for skin, it's like, can we help collagen here? That's a little different than fixing this entire internal cardiovascular system. They're different. So when we look here at normal, of that 120 over 80, that is considered normal range for anyone. But it might not be necessarily a target range for everyone. And this is why really having an individual relationship with your doctor is important, because you might have an underlying medical condition that would put you in a category where your target is even lower than this. Like if you've had some heart problems, your target might be 100 over 60. Also, if your blood pressure has been running at, say, 180 over 110 for a long time, your initial target blood pressure might be more in the 140 over 90 range. And then once your system acclimates to that, you might try to get it a little lower. It sort of depends on how you're doing. So there's a little bit of an art to the management of high blood pressure. But in general, when somebody's in the less than 140/90 range, we usually don't get too excited, but we might make some recommendations. Diabetes is sort of a special category, right?
Well, let's not go into that weeds yet.
Okay, we won't go into that weeds. So in general, once you're over 140/90 consistently, you'll probably get a diagnosis of hypertension. Is hypertension and high blood pressure the same thing?
You're asking me?
Yes.
Well, I think I know what you're going at. So, no, they're not the same. The thing that you can get into trouble with is that if you monitor your blood pressure on an hour-to-hour basis, you're going to be all over. The numbers are going to be everywhere. It's not like, normal people are 120/80, and that's where they are. And then when they creep up to 140/90, no. Blood pressure is affected by so many things that it's bouncing up and down. And so these are kind of, averages.
Right.
We like you to be around 120/80. It doesn't mean if you're 130/90 or 130/82, you immediately have high blood pressure.
So what are some things that we would see a normal increase in blood pressure that we would not consider hypertension?
You mean number-wise, or?
Yeah, like if somebody's blood pressure was up, during a certain context, where would we consider that to be normal?
Well, so there are a lot of scenarios where I would expect your blood pressure to be up.
Yeah.
So, and that's variable. Your adrenaline is rushing. You're taking a Monster, an energy drink. You're doing
exercising.
Right.
Yeah.
You're scared. You're at the doctor's office. Now, I don't buy the white coat syndrome completely. I do know it goes up, but I think people attribute more to the white coat syndrome, meaning that, oh, I'm scared, I'm at the doctor's office, that it's so high. I think, anyway, that's a different story, and that's my own thing. But in general, I tell people not to be a slave to the numbers, even if you have high blood pressure, because, if your number goes to 150/100, whoop-de-doo, I wouldn't change it. If someone came into you and they were on blood pressure medicines and today it was 150/100, would you make a change on that one number, or what would you do?
So if somebody's coming in with a high number, either with pre-existing known hypertension or no known hypertension, in general, we don't react to one number. And it's because of what we were talking about. So say, they've had a stressful morning, they had 2 cups of coffee, they rushed to get here, somebody cut them off in traffic, they ran in, they were stressed because they were a little anxious about being weighed. And then right after that, we took their blood pressure and it's up a little. I don't know. Something that I often do is wait till the end of the visit and take it again, because sometimes it's actually gone back down into the normal range. Other times we'll have people check their blood pressure at home when they're calm and at rest and not stressed out, and see where they're at. The other thing that I find more useful in an older population is they sometimes will have a normal or high blood pressure while they're sitting, but when you stand them up, their pressure drops. And so that can lead to side effects if we're trying to chase a low number. And so getting their blood pressure both seated and standing is something sometimes that's very wise to do in an elderly person.
Do you have any questions, sir, Jeff?
I do. I'm just curious. We talk about, the example. I love the example you gave, Dr. Kim, about the bottle blowing up with the water in it, and it's kind of that hidden thing. But are there any signs that maybe somebody's starting to move out of that normal or safe range into that it gets my attention range? Are there any symptoms they might see, whether it's dizziness? Is it shortness of breath? Is it vision issues? And anything there that might be early signals?
Unfortunately, there are, but they run into so many different things and they're non-specific. I mean, other than the obvious, I have a splitting headache and then I pass out, right? So, that you think that's a burst blood vessel, but, fatigue, headaches, dizziness, vision changes.
It's called the silent killer because you can run a blood pressure that's causing damage to your system for years and really have no symptoms at all.
Right.
And once it gets up to a high enough level, people do start to show signs of stress on the cardiovascular system. But there are some people who will have episodes of dizziness or just not feel right. So it's easy enough to check your blood pressure. So if you're having any of these kind of, non-specific type of things that could be caused by a lot of things, blood pressure is an easy thing to check to make sure that it's okay.
When you say it's easy, is it something we can do at home, or do you mean it's easy for you as a physician to check our blood pressure?
Both. It's like, you can pop by pharmacies. They often will have a blood pressure machine for public use. But with COVID, maybe not. There are a lot of different options for home monitoring, but I found that usually people don't invest in those until they actually have a diagnosis of high blood pressure. But you may be able to ask around, and maybe somebody has a blood pressure cuff.
Yep.
So the way you want to check your blood pressure when you're at home is you want to do it when you're calm, and you want to be seated for at least 5 minutes before you check it. You want to make sure you're well hydrated, and you don't want to have just had an argument with someone. You just basically want to be sort of, non-anxious, sort of resting. And then you don't want to do this. You want to put your arm out like on a tabletop, and either the wrist or the upper arm cuffs are okay, but the upper arm cuffs tend to be a little more accurate. So if you have a wrist one, use it, but if you have an upper arm one, that's great.
Yeah. And you want to try not to have clothing underneath it.
Right. So you'd want to put it on the skin directly, and then you usually just push a button and wait. And that's all you do.
How often is something like this that you recommend? Like if somebody's feeling normal, the thing that got my attention, you said, hey, it could be running its risk for years before it ever shows up. How often should someone actually be testing their blood pressures? That, hey, every time I tend to go to one of the supermarkets that have one of these things, I just pop in there because it only takes a minute or two, or is it something once a month? What do you have kind of this overarching recommendation?
If people are not known to have high blood pressure or have pressure that's been creeping up, so they're basically in the normal range, checking it once or twice a year at your doctor's office is fine, as long as there's no change in your underlying health status. So, for instance, say you put on 30 pounds during COVID, maybe you should check your blood pressure, see if there's been a change. Also, we see changes during pregnancy, changes during treatment for cancer, that type of thing. So then it would be monitored more often. If you've got your blood pressure has kind of been creeping up and you're keeping an eye on it, maybe once a month is reasonable. But for most people, they're really not going to need to do it that often. It's one of those changes that happens over time. So as long as it's being monitored in a person without another big health change, once or twice a year is actually fine.
Let's talk about that. Let's talk about that time. Let's say, for instance, somebody does go into a location, they're doing it on their own, and they're starting to see this pattern of a higher blood pressure. At what level should they say, okay, it's just a little high. It's 115 or it's 125, and then it's 130. Is there a number there where you said, hey, this is a time where you probably should get your doctor involved?
I think if you're routinely seeing over 140, over 90, you should at least have a conversation with your doctor.
Yeah. And then I would say, even if you're getting closer to that, we wouldn't do anything but tell you the things that we've been talking about on this show. Are you eating well? Are you not eating well? Are you sleeping? Are you not sleeping? Are you stressed? Are you not stressed? Are you exercising? Are you not exercising? Because those are the things we would say, that's what we would do. Even if you came in at 149 over 100, the first thing the recommendations say are lifestyle modifications. And so,
I just have one other item I want to pop up here and see what you guys think about this, because we think about high blood pressure. I should say we people on the street might think about high blood pressure as a stroke only, but there are some other potential symptoms, and you mentioned it. But I just want to pop this in. This is from the American Heart Association, but if it's not as accurate as you'd like to do, I'd love to have an opportunity to just kind of clean it up a little bit. So let's just pop that in there real quick, and then just have a conversation about this as far as, are these symptoms or are these long-term things that people can start experiencing if they do have high blood pressure?
So all of these are long-term risks. So the ones that are most a risk if you have extremely high blood pressure are the stroke, vision loss, heart attack. The kidney disease and sexual dysfunction are really common long-term effects, as is heart failure. In fact, high blood pressure is the number one cause of heart failure in the United States. And a combination of having long-term high blood pressure and then having a heart attack is a 1-2 punch that often leads to heart failure. So knowing that, you've got this basically high pressure in your system that's made of these really delicate blood vessels. Over time, what happens is, in response to that pressure, those tubes start to fibrose. And when they do that, they're even less stretchy. So once you get that thick fiber being laid down in the blood vessels, they're even less stretchy and they're more likely to rupture. And that's where we see the strokes. Or we've talked about a little bit with cholesterol, how when you have that deposit, sometimes it can rip off the lining and cause a clot. Well, that's more likely to happen when there's a high pressure system. So that's part of the heart attack cause.
Yeah, and the heart is a muscle. I know people don't think of it as a muscle. So just like every muscle, if there's more resistance, if there's more pressure that has to be pushed through to get your blood through these non-stretchy pipes, the heart has to pump harder. It's going to grow thicker. And as it grows thicker, that's not good for your heart. You don't want a thick heart, because eventually what's going to happen is it's going to poop out. The heart doesn't get it won't get to Arnold Schwarzenegger status where you're like, hey, I have no problem, puny vessels. No, it gets to a point where it actually gets floppy and no longer works. And that's kind of the heart failure. That's the one type of heart failure you can get. So,
yeah.
Well, let's kind of wrap up today's conversation about high blood pressure. Of like, okay, now we understand what it is, its effects, what those danger signs are, and the different way that it's measured. But what steps you kind of alluded to a little bit, Dr. Kim, about, hey, you need to do the things we've been talking about on this show that you guys have been talking about on the show. Are there other things that you can do when someone comes to your office and there is high blood pressure? Besides, is it lifestyle is a big change? And then is there medication? What's the process there?
Absolutely. So, we talked a little bit about how we can't actually reverse some of the aging in the blood vessels, but there certainly are things that people can do to reverse some of the other causes of high blood pressure, primarily exercise. And it doesn't have to be like boot camp level exercise. Even as little as going for a brisk 15-minute walk every day actually helps the system be more compliant or more stretchy. So you will have a decrease in your blood pressure just from that low level of consistent exercise. That's all it takes to see an improvement. Now, if you exercise more than that, you see additional improvements. There is a level at which you kind of max it out, but most of us are probably not going to get there. So if you can do that minimum, you can see improvement. So anything you can add to your cardiovascular workout, this is your cardio. So things like running, swimming, walking quickly, biking, anything that gets you out there and gets your heart pumping is actually going to help lower your blood pressure. And then diet. You want to talk about diet?
Well, it's specifically salt, but I think, eating healthy, like you said, eating the rainbow, um, less sugar, all of that is really going to help people. But specifically, if we're talking about high blood pressure, it really is salt. If you can minimize the salt you're eating, not adding salt.
Also, there are some diets that are associated with a lower blood pressure, and this is along the lines of the Mediterranean diet. So, high in antioxidants, low in saturated fats. So, low on red meat, high on fish. Lots of olive oil, not so much butter.
Right.
That
But
kind of thing.
that would be good for anyone, even without high blood pressure. So.
But it can help with blood pressure. Yeah. And then the other thing is medication. And often we don't want to go to medication first off, but sometimes people will come in with a blood pressure that's extremely high, or they'll have a lot of other side effects, or they're having symptoms from their high blood pressure. We'll probably need to start them in medicine while they're working on the lifestyle. Weight loss, when it occurs, often will get people off their medicine. So sometimes we'll get people down into a safer range, have them work on lifestyle, and as they're successful with implementing some lifestyle changes, either their medicine can be tapered off or even stopped. It just depends on the individual. So it's something that we think about a lot. We think about each person's medication choice very carefully because there's a lot of pros and cons that go into it. There's a lot of factors that we consider, including other medicines they might be on, underlying health conditions, family histories, their risk profiles for certain other problems. So we want to make sure that we get a really good fit, the best fit we can, that goes along with the data that says this medicine has the best benefit in this situation versus that one. So it's something that when we first started in medicine like 20 years ago was kind of simpler, and now is like super complicated. And so the adjustment of medicines and the decision has really become more sophisticated over the last, I would say, 15 years.
Yeah. And then there's some different diseases that can impact or make it harder to treat, like sleep apnea. If you have that, your high blood pressure is going to be harder to treat. So there are a lot of things that your provider needs to go over to make sure that you're getting optimal treatment. So
exactly.
All right. No, I didn't go away. Just had a little computer issue there. Well, okay. So bringing it all together, we talked about what is high blood pressure, what are those levels of it, and when should we actually take some action, how we can really check it ourselves or go into our doctors a couple times a year and have that done. If we start to notice a change, definitely go in and see your doctor. And then also how to treat it. It sounds like one of the biggest impact on this is really, guys, it sounds like our lifestyle choices, of changing what we put in our bodies, and really how do we work out this body? Do we add some exercise? It sounds like cardiovascular has a huge impact versus if we're just pushing weight around. Cardiovascular has a nice impact on our heart health. Is that correct?
Yes, there's a lot of benefits to weight training, but for our cardiovascular health, the cardio types of workouts have really good benefit.
And then, of course, there's always that choice of medication. As you said, it's not your, depending on when they come in, at what level they are, it's not always your first line of defense. And the interesting part you said is weight gain. A quick little story. I won't mention anyone's name. We just had some guests in over the weekend, and we hadn't seen them for quite some time. And they were one of those people that put on the weight during COVID. And she's always been very healthy, and she's now on high blood pressure medication, and she's losing weight. She's already lost about 15 pounds. She says she has about another 15 to go. The good news from what you've said is there's a good chance that could impact her need for medication for high blood pressure. So if you're struggling with that, it sounds like we have to go back to, hey, what is the root cause? If it is our overweight, then maybe we have to look at, hey, what do we put on our body, and are we sedentary? And then start changing some of those things a little bit over time. And of course, as they all say, is this something we want to check with our doctor before we make any radical changes?
Absolutely. And especially if you've got, if you've been overweight for a long time and you've got high blood pressure, you want some guidance, because you don't want to put yourself out there and totally stress out your heart without knowing whether your heart can tolerate that. Mm-hmm. So sometimes we need to kind of help people get back into a fitness regimen in a way that's not going to cause them an additional problems.
Yeah. And these are ongoing discussions that you need to keep having with your provider, not kind of once a year, see ya, come back. So.
Well, along the bottom, I put the information there because, you guys do things a little bit different at Coachella Valley Primary Care. And that's where we are members of your program, and we can actually have more of that personalized relationship. And if you're in that situation, you're saying, well, I don't have a primary care doctor. The number's on the screen at 760-642-5549. Do you have any spots available in your membership for new members, and what is that process?
Yes, we do. We're open. And we take any, all ages, and the process is, you give us a call. You can learn a little bit more about us. You can go to our website, and we just feel like people are worth more than just a 8-minute visit. We feel people are more than just what your insurance will allow you to do. So, we have a membership type program. It's a direct contract between you and us. And that allows us to be able to talk about things like this. I mean, this could be an actual conversation that we have with you. I know we're having it with Jeff and with everyone out there, but this is not uncommon to what we do here. Sit down for an hour, talk about what's going on, and come up with a really good game plan and move that needle however it needs to move. And we feel that's the way people get healthy, not 8-minute visits every, however often, and struggling to get in to see your doctor. So.
That sounds great. Well, again, the information is on the screen, whether you want to check them out on their website at CoachellaValleyDPC.com or their phone number at 760-642-5549. Guys, thank you again for talking about a topic again. Is that you called it the silent killer? Yeah, the silent killer. It's one of those things that by addressing it now, just checking in, no matter who you are, maybe you should have your blood pressure checked, find out where you're at, put that line in the sand, and then go check it out a period later, depending on where you're at, and decide now to take control and have the optimum lifestyle, because this again is your personal health. And when you take care of it and you have supportive cast like Dr. Burris and Dr. Kim in your corner, things can be a whole lot better. So I want to thank you both for being here, and reach out and get in touch with Dr. Burris and Dr. Kim if you have any further questions. And please, if you're seeing this in a recorded, it's not live, put your questions in the comments, and Dr. Burris or Dr. Kim would be more than happy to jump back in there and answer your questions. Until next time, Dr. Burris, Dr. Kim, any last thoughts before we head off and take on the world for another week?
No, I think we're good.
I love to catch them speechless, but because they've been very generous with their time. Guys, thank you so much. Have a great week, and we'll see you next week on Your Personal Health.